the time to focus your efforts on planning and preparing for this incoming COVID-19 pandemic. We have a couple great points to get through. Before we start, we have everyone currently muted. We do encourage you to send any of your questions through the chat feature, and we will address them as they come in, or towards the end, we'll have a question and answer section. So to start us off, we have Jay Strickland, CEO of Strategic Solutions.
So good morning. Welcome. Thank you for investing some time this morning to talk with us about this. We know you guys must be incredibly busy right now, and so it just makes your time even that much more valuable to us. We wanted to bring you some information based on our understanding of the situation and places where we think we can help. We also are really interested in hearing your feedback on our understanding of the situation, where we might need to modify any perceptions, or think about things that we can do, efforts that we can make to help you guys that we haven't considered yet. So to that end, we just wanted to talk about a handful of things today. We're going to probably spend just 10 or 15 minutes on some slides and then open it up for question and answer and discussion. So I want to start off by kind of putting some context around the situation and really our understanding of things. We're spending a lot of time doing what we can to prepare for this, and we're drawing information from a lot of different sources. This dashboard that Johns Hopkins has put together is something that we've been looking at and focusing on and drawing information from. I would expect that at some point we'll see them over here in the bottom right-hand corner. We kind of take a look. We're looking at the rate of infection versus the rate of recoveries, and I think their graphic has some value. I think there's some things they could do to improve it, but we're kind of getting some information from here, and I think that's forming the basis for a lot of what we're doing. We're, I think, in a unique situation with our focus on healthcare, and we're trying to make sure that we have all the tools at our disposal in your arsenal for you all to be able to address your response to the situation. I think we're also in pretty good shape ourselves as a company. We spent a lot of time focusing on business continuity, and our team has a good plan, and we're uniquely able to work remotely and things like that. So we're trying to shift the focus from our response into what we can do to help you all. We know that the scope is unprecedented about this, but just to put COVID-19 in perspective, what we're seeing is that clearly the fatality rate is lower than some of the other things that we've faced in the past. We also know that we also know a little bit more about who's most highly affected by this and who's most at risk. But the thing that I think has everybody's attention the most is certainly the rate of infection and the speed at which it's sweeping the globe. So these slides here really caught my attention more than anything else. When we look back to MERS a few years back, that doesn't even show on this graphic as a rate of infection over the first year. It really took 2.5 years to get to 1,000 cases. SARS shows up, but the initial outbreak was almost was several months in, and the rate of infection was much lower. But you can see the slope of the infection rate for COVID-19, and it's obviously through the roof. It makes the graphic almost unreadable.
Jay, if I can interrupt you for a second, it seems like some people are having an issue accessing the actual slides. If it is asking you for a password, the password is welcome with a capital W, then an exclamation point. So capital W, ELCOME, exclamation point. And I apologize if anyone's having that same issue.
Thank you, Megan. I probably won't.
So we're going to send these out too.
Yeah, exactly. So we'll follow up with a recording of this and some additional information as well. And I'm probably not going to loop back and cover those again because I think they just set the context a little bit. So I'm going to keep moving forward. So given that information, we've formed some objectives that that we believe are our best efforts and what we can do to best help you, and that's what we really wanted to share with you today. So I think in general, the community is realizing that the objective of all the things that we're hearing, all the cancellations of schools and sporting events and things like that, is really about not avoiding infections, but delaying and flattening the curve of infections. What I think we'll be seeing more of in the future are key performance indicators of things like hospitalization rate, and in the case of your ambulatory outpatient clinics, something on the order of number of patients seen versus number of patients that you are talking to on the phones, things like that. The reality is that we're putting in place all the things that we can do to try and help you all be able to increase your capacity and be able to draw out the infection rate and the rate of spread and outbreak, so that potentially we can flatten that curve and keep the number of cases below the capacity of hospitals and your systems individually. So to that end, we are hearing a lot in the media about social distancing, and certainly getting a course in that is I know everything on my calendar in the near future personally has been canceled. All the events that I was signed up for are all stopped. So we know that there are technical things that we can do to help you with that and set the stage for being able to address team members of yours that are quarantined and patients that are quarantined. So we also know, based on this study from Oxford and certainly just intuition, that there's a difference between companies that handle a crisis well, and companies that don't. As you see on this graph, in the first month or 30 days, both the company, let's call it company A in blue, that responds well to a crisis, and company B in red that does not respond well to a crisis, doesn't manage the crisis well, both of them see an initial impact. And I think that's where we are right now. We're going to probably for the next month be all feeling and experiencing challenges and concerns about our ability to handle this situation. But the companies that pull out their business continuity plan, dust that off, fine-tune it, and find the right way to respond will not only be back where they were, but actually end up differentiating themselves from the crowd and be the practices and the organizations that are increasing value to your team and to patients and to the community as a whole. So with that in mind, we want to talk a little bit about business continuity planning. We know we've certainly worked with a bunch of you all to develop business continuity plans, and we know that there's some of you out there who don't have as much in order on this, but that's not to say that there aren't things that can still be done. I threw this slide in primarily because for years we've been talking about the different things that contribute to the value of a business continuity plan. And of this whole slide, the viral outbreak was always the one that we kind of chuckled about, zombie apocalypse type of thing, and we always kind of wrote that off. But here we are, and it is absolutely a reason for implementing your business continuity plan. In the event that you don't have that, or that it's dated or anything like that, these are the key pieces that we feel like it's most important for you to focus on as an organization. And of these, probably the one that you would think of first is thinking about your team and your staff and how you manage a situation where they're either quarantined but healthy, or actually a reduction in workforce where people are at home and unable to work. So those are some of the things that we want to talk about today. So I'm going to start asking different people from our team to talk about different aspects of this. We're going to start off by talking about your people internally and how they best manage this situation. So clearly some portion of the staff are going to be working from home. We're not sure exactly what that looks like. In our case, it's probably going to be 100% of our staff working from home at some point. I wanted to ask Andy to talk to you a little bit about the value of communication in that environment.
Sure. Good morning, everyone. As you know, telephony is the backbone of your system and communication in this viral outbreak, probably going to be the key component to keeping your working environment safer by keeping patients home, keeping your staff quarantined themselves, but still being able to work. So how can you do that with your telephone system? How flexible is your telephone system? Can you work, can they take extensions home with them? I think some of you that we have on an 8x8 system, you know, when we deployed that, we left with a box of power adapters. You may want to have those handy to hand someone to take home with their handset so they can plug into the power and plug it into their broadband modem, and they'll be able to use that phone there. Others can use a soft phone or a mobile application if you're, again, on a cloud-hosted system on our system, 8x8 system that we've helped you deploy. You can disperse people, call groups, ring groups, have them working from home, have some in office, have, you know, to maintain some care of patients that do come into the office, but also have others limited exposure, being able to work and still answer calls from home. You can quickly change memberships, or how quickly can you change memberships of your groups in your current systems? How quickly can you change your messaging, your outgoing messaging and call flow to add, remove folks that maybe have become ill and can't participate in the call group anymore, add someone else in. You know, it's about flexibility and changes and how you can get people to still participate in your patient care while being remote and keeping the social distancing going there. So.
Okay, and certainly another aspect of that is working from home and having to make sure that you have the right technology for that. So I'm going to ask DJ to talk to us a little bit about some of the concerns with that.
Good morning, everybody. So along the path of social distancing, we're going to have a lot of different options available to you for accessing all of your services that you normally use. So some of those will be like using RDS to leverage getting into your main EMR environment, using VPN connectivity to get you connected from either a home computer or a computer you take from the office home to get connected into your network and access your services, and then additional options for remote control, using a computer at home to access a computer that is still in the office, which will give you the ability to run like a true skeleton crew and still remote into your computers in the office. So the good thing is that there's a lot of options available to you. To go along with that, Cisco is kind of helping out to adjust some of the licensing. So your original business plan of having people work from remote, which may be like a smaller license pool, can be extended to a larger license pool to accommodate the larger amount of people that might be working from home. And that'll apply to like Cisco WebEx and VPN connectivity with AnyConnect. And so really cool deals that Cisco is helping do with that we can review after. But the most important thing about this, though, when you are doing remote access and you're poised to remote from home, is to make sure that it's done ahead of time. We don't want to create a scenario where you need to have your users, if not potentially all of your users, try to remote from home, and then something's not working right for them and they need it at that time. So the big thing is to make sure that you have a correct setup that works for you in any of these combinations, and then making sure to test it prior to. I know a lot of our clients are already calling in, making sure that they have VPN connectivity. The big thing that I'm telling them is like, is there any way for us to try it right now? Can you connect to a hotspot so we can check it? So that's the biggest takeaway, is that yes, you have a lot of options, but you definitely still want to try the things before you even get into a bad situation.
Great, DJ. And can you tell us a little bit about remote control options?
Sure, yeah, the remote control options we'll be able to do, like, we'll be able to leverage our existing Screen Connect setup, and you'll be able to use a computer that you potentially have at home and create a secure connection using Screen Connect. We can set up a license for you to be able to remote into your computer at the office. So if you have like an IT personnel that could just be in the office, all that needs to be done is your computer in the office needs to stay online, but you can use your personal computer to essentially remote control your computer at the office. So it gives you the opportunity to not have to set up a computer for VPN access if that solution would work better for you.
Great. And of course, with that remote access comes the need for security and management. So Austin, maybe if you can talk to us a little bit about that and the concerns there.
Sure, yeah. Good morning, everyone. So the only thing from my realm I want to make sure that we talk about is if we introduce any new workflows and devices to the organization, that we also look at the new risks that might also come with those. So with any new authorized devices, we want to look at things like antivirus and anti-malware and make sure that those virus definitions are updated, making sure that any devices connecting to your network are fully patched with the latest Microsoft patches, using supported operating systems. So older OSs, Windows 7 has now gone out of support, so any OSs that don't have the latest security patches, we don't necessarily want to allow those to connect into the network, so checking things like that. Utilizing both managed encryption and loss prevention software, if that is something that would be advantageous, to make sure that we're both protecting any data that gets put on those newly authorized devices, as well as making sure if they get lost, they can be handled appropriately. And then overall, just maintaining your HIPAA compliancy or any other compliancy standards that you're looking to stay up to date with, checking things like screen locking policies and password policies on those new devices. And for any of those questions, we're here to help, so just let us know if you want us to check any of that for you.
And finally, one of the most important points is just keeping staff clear on what they're going to need to do. So I'm going to let Megan talk a little bit about that.
Absolutely. So as we start authorizing staff to work from home, something that maybe they didn't do in the past, is going to be even more important to create a work from home policy that clearly outlines your expectations of these employees in terms of having the proper technology. Austin sort of briefed us on that. We want to make sure that they're using secure and supported machines to remotely access your computer systems, making sure they're using a secure connection, exactly what DJ was talking about. They're connecting either through a VPN or a secure channel so that they're not introducing any risks in that connection process. You want to make sure that your employees are being told your expectations for communications. More than ever, it's going to be important for staff and leadership management to communicate with their staff and their employees, making sure expectations are clear on the preferred mode of communication. Do you want them to email, call, chat? Do you have those things available to your employees working from home? And then making sure you're setting clear expectations for their schedule, availability, any overtime they may have. While they'll be doing the exact same work, it's in a whole different environment, and so creating this work from home policy that can be distributed to users is going to be more important than ever, but also communicating a sense of trust in your employees, that you trust them to get the work done and to do it securely. Once you have this sort of work from home policy created, distributed, and understood, it might be important to review or create a bring your own device policy, which outlines your expectations for the security and use of the device, exactly what Austin was telling us, but in written form, and then also your acceptable use policy, reviewing that with your users so they understand what they are allowed to do and should not be doing when they are connected to your practice or business resources.
Great. All right, thank you, Megan. So now shifting to think about, I'm sorry, Andy, we'll hit real quickly meeting tools. Sorry.
So remote meeting tools, SSBA has been working with a couple of our partners to take advantage of some of their current offerings. BJ touched on a little bit of it. Cisco WebEx is offering free utilization of their tool through, I believe, July, or for 90 days, maybe, something to that effect. Also, 8x8, who you don't have to be an 8x8 subscriber, but they're offering use of their meeting tool for free as well. It's a pretty straightforward, simple tool, kind of a one-click, name your meeting, send out the link type option for that. So you can have a WebEx meeting, very much like we're having right now, or an 8x8 meeting where you can have video and conferencing going on with them. Pulling your staff together, maintaining that communication that Megan alluded to a little bit, having quick pull-up meetings, having, early morning touch bases to say this is, these are our most important triage items to take care of for the morning or what have you. But there are these tools available, and again, a lot of these vendors are stepping up, offering them for free or a true up later on down the road or something to that nature. So keep those in mind, and we can help you find those tools and make use of them as needed.
Yeah, and just to add on what Andy's saying, you guys will all receive an email after the conference call today with some additional information like links to that kind of those type of offers. And okay, so now transitioning on, I want to talk a little bit about the impact to patients and the best, some things that we think we can do to help you guys best treat patients and take care of the community. So, of course, with this social distancing, one of the keys is going to be trying to keep the patient in their home first and not always coming to your office. So we wanted to see what we could do to help you extend your care to the patient's home. So Andy is going to talk a little bit about that.
Sure. A lot of these are touched on too in the earlier with staff working from home, but again, it's ease of greeting update, right? Using that first auto attendant message to tell patients one-to-one ratio, if necessary. Don't bring extra people. Don't come, let's triage you first. Don't just show up to the office if you're having symptoms. How easily can you change those outgoing greetings and planning? How easily can you add and remove people from your ring groups and call queues so that you may have extra people that need to fill in, because again, this is going to be probably a high volume call issue for you guys. So how easily can you add people in to help with coverage and help answer those calls? Again, workers can work from home. They can transfer calls. Just the telephone system doesn't work the same when they're working remotely. If you're on a cloud, agile, flexible system, it will work very, very similar. You won't notice the difference. Your patients won't know necessarily that you have people working from home. You're maintaining that professional front. Calls can be made still from those calls, showing that it's coming from the office. You don't have to route overflow calls to an answering service possibly that you already have set up that may not handle the calls in the same fashion that you would. So it's about keeping that professional appearance, keeping kind of the status quo of what your patients expect from you, from helping them, and the service content level. So
great. And so, we'll be poised to help you guys make any adjustments you need to call flow plans and things like that to better support you as you're going into that mode of operation. Okay, so moving along, we're going to talk a little bit, Megan's going to talk a little bit about some options for patient outreach.
Like Andy said, what we are assuming patients will want to do is call to speak to their provider to determine if care is needed. One thing that we can do is supply you with a self-assessment tool that was put together by the New Hampshire Division of Public Health Services. This is essentially a one-page document outlining what patients can look for in themselves to determine if care is needed and can be sought, and then what to do if they feel like they are exhibiting those symptoms to take care of themselves and those around them. It's an easy document that you can distribute to your patients to make sure that they're informed and able to work with you to provide the best care for themselves in the community.
And Megan has also worked on putting together a web page for our response to COVID-19, and you guys will see that at the end of the presentation here. But that self-assessment link, I think, our tool is on our web page, so you guys can take a look at that. Okay, so moving along, can you talk to us a little bit about how virtual check-ins might help?
So additionally, like we said, if a patient could be calling to speak to their doctor, Medicare actually allows for billing of what's called a virtual visit or an asynchronous visit. A virtual visit can be as simple as a 5 to 10 minute phone call with the patient, as long as they haven't been seen for the same thing in the past 7 days, and as long as it doesn't result in additional care in the next 24 hours. So taking advantage of these sort of virtual healthcare examples means you can be getting paid for the things that you probably will be doing for the next couple of weeks. We'll send out additional information on that, but it's just making sure that you're providing care to your patients and also billing for that time.
Yeah, and you know, this option has been around since 2018, but I think a lot of practices kind of glossed over it. But the way it's written, it is ideally, I mean, it's directed specifically for this. It's designed for non-face-to-face interactions that are short in nature with the intent of determining whether a patient needs to be seen in person or not. So thanks, Megan. So can you tell us a little bit about video visits?
Absolutely. So sort of the next step up, under Medicare, a video visit is considered telemedicine or telehealth, which has specific limitations on how you can provide that service to Medicare individuals. Right now, the Department of Health and Human Services is poised to waive some of those restrictions, and if or once they do, we can open up that service to a whole lot more of the community. But essentially, a virtual visit is seeing your doctor face-to-face. It's two-way, audio-visual. It's meeting with your provider from the comfort of your own home. We have worked with practices to develop a rapid managed deployment model for this, so we can get you set up with this very quickly so that when the time comes, your providers are able to actually do more than just talk to their patients. They can work with them, consult with them, and have a real office visit from the comfort of the patient's own home, so they are not at risk of infecting others, but they're also in a more comfortable environment.
Great, thank you, Megan. Okay, so we just put a slide in here to cite some of the sources for the slides that we have in here. And I just wanted to wrap up by bringing this slide up here again. I think, you know, these are some of the things that we wanted to get out to you early. There's a lot more that we're working on, but we felt like it was important to get this stuff out as quickly as possible to you guys, because we know you're right in the middle of planning phases for this, but we want to make sure that you're the company that is responding effectively and building value in your organization. So that's really the driver behind our presentation this morning and our continued efforts. And so with that, you know, we want to open it up for questions and discussion. Do you want to unmute people? Do you want to have questions already?
We do have one question before we launch into the rest. So are we currently seeing, or do we think we might see a impact on the internet due to more people working from home?
So that's a really good question. And I think it's something to consider. And it's probably not just the people working from home, but I know my son is going to be at home probably trying to be on the Xbox continuously, and probably my neighborhood is all the same. So it's a valid concern. I don't know, you guys have any opinions about that? Anybody want to weigh in on that?
Yeah, I mean, I think that you'll see it. Obviously, there'll be an increase. How that will be affected, you know, I think the internet has become much more resilient than it was, so the routing can be changed quickly. Things can be added, you know, equipment is added quickly to handle some of that. So,
but it's a good point, and there are some controls and dials that we can use on our end to look at quality of service and bandwidth changes and things like that. We have a little bit less control in your home to do that, but there are tools that we can provide to your team members to be able to measure that before they get ready to get on a call with the patient, so they know what to expect out of quality of voice and things like that. So really good question, and that's got the wheels turning for us here. Everybody's kind of nodding and thinking about what we can do to better answer that question in the future.